Young, and I work in the Mass General Chelsea Clinic. Today, I'm very excited again to be back in this community health education show. Today, we're having an amazing panel to discuss another resource that we have in the community of Chelsea. I want to introduce you to our panelists, which is Stephanie Schul, who is the director of Connect Now from the Neighborhood Developers, and then Sylvia, many of you from the community know for years, Sylvia Ramirez, who works in the Chelsea Collaboratives, now in the position of a special project manager. And Lee Nugget also has been for decades here working for the Community Action Program in the city, CAPIC, Inc. We're going to have an exciting conversation about one of the social determinants of health that have most impact in our health. Thanks. So we're going to continue our conversation about social determinants of health. First, we're going to redefine again what does social determinants of health means. It is defined by the World Health Organization as the condition where we are born, grow, learn, live, play, or worship. A lot of these conditions are shaped by how power and resources are distributed in the different communities and at different levels. I want to emphasize that it's not the resource that we have or the power, but how it is distributed among the different places. So the fact that social determinants of health can shape our health is because these are things that we face daily. Every day we face issues like how are we getting our food if we have a entrustable childcare, how is the condition of our job and how we go to work or how we go to learn in schools. All these different things can shape our health. This also means a very important opportunity for us to shape our health even before we go into a healthcare facility or to see a doctor. So it is time for us to also to take advantage of this and be able to shape our own health by affecting or changing and modifying all these conditions of social determinants of health. As we know, there has been a lot of investment in health in our country. And for the money that we invest for health, we should have one of the best health around the world. However, we have seen that because we need to work more on these social determinants, we have not been able to achieve the health that we should be achieving overall. For this show we have the goal that we can inform you of all the resources that you can find in the community and how you can utilize these resources to improve our health. So thank you again for coming to our panel. First of all, we would like to discuss a little bit, I think that we have a term here about job insecurity and unemployment. Stephanie, would you be able to help us a little bit to understand what is unemployment?
Sure. So first of all, the Connect program, which is housed at the Neighborhood Developers, it has 5 partner organizations that are all working together to help people get ahead in their lives economically. One of the areas we work in is workforce development. We have a one-stop career center in our building. It's one of the 5 partner organizations that are housed at the Neighborhood Developers. And that career center is part of this massive system across the country where when people are looking for a job, actively looking for a job, they walk into that career center and they sign a little book that says, okay, I'm here at the computer and I'm working for 2 hours looking for a job. That number of people from all across the country gets wrapped up into statistics that the Bureau of Labor Statistics in Washington, D.C. Analyzes and says, okay, the unemployment rate is this. And that is how the unemployment rate in Chelsea was generated at 2.9%. However, that's just the official number. What we care about is not just the number of people or the percentage of people who are actively looking for work, but also those who are underemployed. And so unemployment is a very important statistic. We care about those 1,400 or 1,500 people who are officially looking for work. But when we're talking about unemployment, we really need to also be looking at underemployment. and the quality of the jobs and whether people are getting enough work to be able to sustain their families.
Grace, definitely you touch a lot of like really good points, and I think that when we talk about underemployment, we're talking about condition of the work, and it comes a little bit more related now to job insecurity. Sylvia, could you expand a little bit for us what does job insecurity means and how we operaalize it or like we work on it?
Absolutely. Job insecurity means when someone doesn't know where their next paycheck is coming from. And this is as a result of many challenges or issues. But it has to do more with the actual underemployment and the low paying jobs, because they do not have like one job that provides full benefits, full-time status, or it's a good paying job. They have several jobs with low pay, lack of benefits, and job insecurity because they don't have a confirmed schedule. They don't know whether they're going to have to work tomorrow versus the next day. Sometimes they work, sometimes they don't. That's where job insecurity comes. Job insecurity is a huge determinant of health because it develops into all these levels of stress. I don't know where the next meal is coming from. I don't know how I'm going to pay for childcare. I don't know how am I going to get to and from. How am I going to pay my rent? How am I going to pay my bills? Due to lack of job insecurity.
Thank you for describing that, and I know that we have like the official definition by the World Health Organization is that the perception that we will not have a job in the future, like the inability to plan our life and have the safety of life. And Lee, that you have been working in this area, can you help us a little bit to understand how is the problem in Chelsea right now?
The, excuse me, first let me tell you, the CAPIC has been in Chelsea for 50 years now. One of our goals and missions is to help people to become self-sufficient, which means, you know, working on knocking some of the barriers that are in their way to getting to the point of getting work. And educating them on resources and, you know, things like childcare, food vouchers, a lot of different things that we help with. But as far as job insecurity goes, in Chelsea right now, we have a very low unemployment rate. It's down to 2.9%. In January of 18, it was at 4.1%, so it's been coming down. However, that, you know, it doesn't consider a lot of the vulnerable populations in, you know, in the undocumented, the transient, and, you know, as Sylvia was saying, to people that are working 3-4 jobs just to make ends meet. We do have some legal people in our office every Friday that help with immigration stuff as part of, you know, getting them into, you know, into jobs and into stable jobs and training and we partner with programs like Lear, which we can talk about more in another time.
Yeah, and understanding also that like the unemployment rate seems to be very, very low, and we are grateful for that. But unfortunately, the problem of underemployment is quite high, and some estimate there's no official numbers. It's like up to 1 in 5. It's like more than 20% of people are on those situations that is causing real stress in their life. Talking about then, like, seems that unemployment is low. Seems that there's a lot of job position open. Can you tell us a little bit what is behind then this problem of underemployment? And when you mentioned about low quality jobs, what exactly is what does that mean exactly?
I think there's an evolving understanding of what a low quality job means. It's something that has been part of the conversation among community organizations for at least 20 years. We know that back in the 50s and 60s, that we were in this wonderful period of time when manufacturing was just booming, and there were all of these jobs where you could get benefits, you had regular hours, you had frankly, just more overtime than you knew what to do with. And things were booming. Their home ownership rates were sky high. And those jobs have been going away. It's through technology, through computerization, through offshoring, and just through contract work. And there's a lot of large trends that are happening in our economy that result in people being employed, but still living paycheck to paycheck, not able to make ends meet, and not able to have a predictable life where they can make the rest of their life work. So I think when we talk about quality jobs, really what we're saying is a job that has some regular hours, that has a predictable paycheck, not a variable seasonal type paycheck, where you have some autonomy, where you have some ability to advance. And Sylvia, what else would you add to that? There's a lot of ways to think about it.
I think that what we've been discussing in our community organizations here in the city of Chelsea, especially through the Chelsea 500 Coalition, is more of how to educate or prepare our community to get great jobs. Not only the unemployment to reduce it, but these underpaying jobs for all these people to be educated and trained and have the skill set necessary to get all these possible jobs that are coming down the pathway. I think it's important to recognize that we are at a moment right now that in the city of Chelsea, like many surrounding cities, the communities can take advantage of all the new hotels and new casinos that are coming in our area, and these are opportunities for our community, but are opportunities that people can only take advantage if they're prepared and have the skill set available. But we want our community to be prepared and get great, good jobs, good paying jobs, that they can have flexibility, they can have a better quality of life, and they will not have this question of job insecurity, that they'll know where the next paycheck is coming from. At the Chelsea Collaborative, we have a workforce development department as well. We're providing education and training for community members, from anything from English to basic literacy, computer skills, and of course we are working with other community organizations such as Connect on how to push and through the Chelsea 500 Coalition with other community partners to make sure that our community is prepared and knows about the resources available for them as we speak actually right now.
Yeah, and Chelsea 500 was really put together to take advantage of the fact that the Encore Casino is about to open in June in Everett.
Yes.
And so the Chelsea Collaborative took the lead and brought a bunch of us together, and we've been working together very closely over the past 8-9 months.
Yes.
To inform the community about these high quality jobs that are coming down the pike. Over 4,500 job offers will be out there made between February and May at Encore Casino. Many of these are most of them are benefited positions.
Yes.
And with good pay. And then there's a bunch of ancillary jobs that are job opportunities that are coming, because guess what happens when a large employer suddenly drops into our area? It means that there's a whole lot of other opportunities for what we're calling the backfill jobs.
Yeah,
and so that's really
we really appreciate all these resources coming out and train people. And I think that you got to the core of the issue when we talk about this is going to be high quality job, but we want our people to also understand and how to figure out if this is a low quality or high quality job. And from my understanding, you talk about a job that causes job insecurity would be if you have lack of predictability, meaning that you can't control, the lack of autonomy on that situation, the lack of also the planning, being able to plan their life around this job, and the lack of peer support. And it seems the community agencies are providing that support, that if they're in a situation that does not know what to do, there is resources to help them to support that. And also the fact that they can go out and search for training, the skills, being able to live up to the satisfaction of the job satisfaction, the autonomy that they can get, and also then the ability to have a community, the sense of community and belonging, that they have support is important for them. And I think that I wanted to discuss a little bit about the health issue. I think that you mentioned about all this stress, and we know that stress causes a lot of diseases, and probably a lot of people will think, oh, everything is in the mind, but actually the mind has predicted. We have studies that have been showing that people with job insecurity, the perception that they're going to not be able to have a job in the future, that perception itself causes a lot of depression, sleeping problems, actually a lot of orthopedic problems such as back pain, knee pain, and also because of this stress cause heart disease. People die more from heart disease and different metabolism questions such as diabetes also cause those problems. A lot of people has actually what we call the reflux problem, the gastritis that we have also has been found much more when people have this stress in their job. Because job actually, when you were mentioning having 3 jobs daily, they don't really have much time outside of job. So it's pretty much the whole life is causing that problem. And these are the conditions including anxiety and that down the road causing more mental health problems. And we know that like by improving mental health can improve the productivity of the patient. So for employers, they would be much more beneficial to have a kind of like a worker for them that are like very in tune and that's have healthy mentally, that can be more productive to them. In regard also about the perception itself, we have to discuss a little bit about, and Sylvia have had experience about different group of people coming from different cultural background, on even gender, like when we have like these social needs of like taking care of our kids, how to get a better education for us to be able to have the expectation to move further up in the ladder, getting like better quality job because our physical condition is going to deteriorate, but our experience actually is one of the biggest assets for the employers, how we can explore that and improve that. That has been very important. Sylvia, would you want to comment a little bit about that, the different groups of having different resources to be able to move up?
I think that there is, obviously in Chelsea, we have a large population of minority people, Latino, and people of color. And at times, due to where we come from, or the lack of language skills, or the barrier of education, or not knowing the resources, creates a huge barrier. I think that our community deserves and has every right to have job security and a good job, benefits in order for them to be productive, in order for them to be better parents, better community members, be engaged, and have a better overall constitution, a family constitution. I think that it's important to also recognize that there is a lot of community members that have skill levels that they bring from their home countries, whatever that may be, and they may not know how to utilize them here in the United States because of different barriers. But we need to recognize that there is benefits and services available, resources available for them, and they just need to search out to our community organizations such as CAPIC Connect and the Chelsea Collaborative. I did want to mention that at the Chelsea Collaborative we have the Jornaleros program, and it is a very active program that we provide education for jornaleros, and we want them to know what their rights are and what they can and cannot do, and how can they get a better paying job and a good job overall, some more stability. I think that having a good job develops into having more financial stability, and whether you live paycheck by paycheck, that doesn't change how happy you may be and how a better overall person you can be for your family, your friends, and even at your job, your productivity, especially being able to eat every night and being able to sleep at night, and being able to be home with your children instead of working 2-3 jobs. I think it's important to keep that in mind, and our community members need to seek out the resources available, because we are here and we're available and we want to help. We want them to be take advantage of these opportunities, especially with the casino coming down, and then all the backfill jobs. Yes.
I think it's also important to point out too that some of the stresses that that we see that people come into CAPIC with is they do have a job and they have a good paying job. However, they've either lost child care or their housing. They can't afford their housing anymore, and this causes a lot of stress. And then they do, I've seen clients that have lost their jobs because they don't have the child care, they don't have stable housing. And I think that that's important to point out, that there are resources to help them with housing, with childcare, and to find, and I think it's important that they just reach out to these agencies to help them, you know, maneuver that system and to find those resources.
And if I could just say a minute, I know I think sometimes there is a little bit of maybe a stigma or a resistance or concern about that going to one of these agencies feels like charity or something like that. And I would just like to say that it's I mean, all of our organizations come from a place of seeing people as resourceful and creative and powerful and whole. What we're here to do is to help people navigate the systems that are out there. Because just like at the health system, right? You come from health. If you just have a cold and you need to get some cold remedy, you can get yourself to a drugstore and buy yourself some, you know, so what do you call it? You know, cough medicine or over the counter stuff. But if you've got a very complex problem, like your kidneys are failing or cancer or something, that's a very complex situation, and you need someone to help you understand how all the pieces fit together and what are the different treatment options. I would just suggest that similarly, we're sort of like the cancer doctors, right? I mean, so we know that there's a lot of different resources out there. We know that there's a lot of pieces that have to come together for someone to be able to get ahead. And so what we're trying to do is to help people understand how to bring those pieces together to get the child care to work, the transportation piece. If you need a little bit of stopgap help with your food, you know, we know where the pantries are and their hours and all that. And we have coaches and job placement people to help people figure out, you know, where could they get a little stronger, or maybe on their interviewing skills or something, so that they know how to get some of the jobs that are coming down.
Like you guys are all touching about the resources part, and I think that to get a little bit more clarification, this sounds like amazing. But like if someone is looking for that help, how they can access these different type of services, and if you can each mention from your agency what specific type of services they can get and how to get that, like how to access.
Well, I mean, for CAPIC, as I said, you know, we have many different programs. You know, there's a responsible payee program, there's the housing program, emergency services, the SUDS program, and we have legal help every Friday. We also have someone there every Monday from the Mass Coalition that works with clients on housing issues as well. So we've been able to help people prevent evictions, to move into more affordable housing, to, you know, we've helped with food, we have food vouchers to help with, so there's many different, and the thing is, I think it's important for people to reach out to these agencies because we all know about these agencies, so that we can refer them, like, I can't do this job part of it, but I know where you can go to get this. And I think that that's what, as you know, we were saying here, I'm sorry, it's important for them to know that it's okay. It's not because, it's not a charitable thing. It's not because, you know, you can't, people are not going to look down on you. This is what we're here for. We're here to help you. Just as some of us have gotten to where we are because we've utilized other agencies to get us to where we're at and to educate us and to help us to reach those goals to becoming self-sufficient.
Great. So it sounds like go to CAPIC. It sounds like a lot of things to navigate, but once you can refer either services inside CAPIC or refer to other agencies. Sylvia, can you comment a little bit how?
I wanted to mention that it is important to recognize that all these organizations in the city of Chelsea, I mentioned this earlier, that we're a very small city, but we are very rich with resources. And we all know of some of the services that each other organizations are offering. And if we can't help them, then we may refer them to CAPIC or vice versa, or to Connect or TND or other agency in the community. At the Chelsea Collaborative, we provide Know Your Rights sessions, workers' rights, housing rights. We have legal help for immigration. We have housing attorneys as well. We also have the Education Workforce Development Department that provides education for our community members. Like I mentioned before, we also have our Jornaleros program, and also, as many of you guys know, that we run the Summer Youth Employment Program in the City of Chelsea, and also the year-round program. We will be offering an apprenticeship program soon that is in the works, and that's something that we will provide more information on it soon, but we're trying to find any possible way for our community to be prepared for the jobs that are coming down the pipeline. I also wanted to mention that we have other partners in the community, such as Bunker Hill Community College that provides education classes, ESL, HiSET, and other training opportunities. They're even offering for free and on Saturday and Sundays, which is an amazing opportunity for people's schedule. And also the Chelsea Community Schools will be offering resume writing, interview prep, and skill smart session for anyone interested in being part of a possibility of a job at Encore Casino. They should take advantage of those, and we all have information about when are those sessions happening and when it's registration and the dates and the times and so on and so forth. So those are some of the opportunities that we have. And I wanted to mention that because through the Chelsea 500 Coalition, which Connect and the Chelsea Collaborative are part of, Bunker Hill also, and the Chelsea Cultural Division and Recreation Department is also part of. So we're finding ways to have more opportunities for our community members to take part in and we get prepared for the pipeline of jobs.
By working together, we're definitely able to offer more and to do so in a more coordinated way and to get the word out on the street, and we can staff each other's events. We're literally making it happen because
we're working hard.
Because the opportunity is so big. It's enabled us to just realize that we have to be working together to be stronger. At Connect, we've been in operation since 2012. The Neighborhood Developers is the founding partner of Connect. We offer financial education, financial coaching, and access to financial products that help you do things like build credit or save money. And our partner organizations are Bunker Hill Community College, which offers also adult basic education at our building that's right in the same building as Family Dollar at 4 Garish Avenue at the corner of Garish and Broadway. And then we also have Metro Housing Boston, who offers housing counseling services and emergency rental assistance. We also have the Career Center that I mentioned, the One-Stop Career Center. And then finally, Metro Credit Union is a big partner that helps our members use mainstream banking products.
Yeah, we have mentioned also, like in the past, in the housing insecurity program, where they have from the neighborhood developer the eviction prevention program, and I'm hearing that it doesn't matter where they start because it's a lot of resources. If they're confused, just go to one of your agency, and then you guys will help them beyond the agency level and connect to them. We will have at the end of the show a slideshow with all the addresses and telephone numbers that you can connect to these different agencies.
I wanted to mention something about the Chelsea 500 Coalition. Our goal and our mission is to prepare our community to get access to these jobs, and our goal is to get at least 500 people hired by Encore Casino, but we're not only focusing on the casino itself, we're also focusing long term, and this is something that the community as a whole is looking at, on how to prepare a community to get better jobs and how to have this job security and financial accessibility in order to remain in our community instead of being pushed out. So we are welcoming any other agency wants to be part of the Chelsea 500 Coalition to please reach out to me, and we're welcome for more ideas and more partners, because we want to make sure our community have access to better jobs.
Sorry, could you comment a little bit about the Lear program and how to access that also? Is that a part or is that together?
Well, the Lear program is a training program as well. It's a career training program. The difference with the Lear program is that the referrals have come through the Department of Transitional Assistance. You do not have to be a client of the Department of Transitional Assistance, but you can go to them. A lot of people go there looking for help. And if it's to do with jobs, then they can get referred through through the Department of Transitional Assistance to the Lear program, which is housed on Everett Avenue. And it's, there's a lot of computer training, GED, medical secretaries, and I know that's not what they're called, but
medical assistant
A
program,
medical
like kind of like
assistant,
work
yeah.
in the, the healthcare team.
so
that
they
is
have
needed.
a lot of, different types of training there, but it is a referral through the Department of Transitional Assistance.
But again, just to your point a minute ago, part of why we do what we do is because there are so many different programs out there, and someone gets some foundation or or government agency gets the idea to create something new, and it's very difficult with this huge catalog of different kinds of programs and different kinds of resources. It is understandably very difficult to
It
really
can be
understand
overwhelming, yeah.
how are they similar, how are they different, which
yeah.
one's the right one for me. And that's really what we do, and so we're kind of like matchmakers, right? Trying to figure out, what little pieces of this big menu, are the ones that are right
Well,
for
there's
you,
many,
perhaps.
and I think,
Yeah.
as Sylvia has said, Chelsea is very rich in their, agencies and the resources for the people of Chelsea. Although CAPIC does cover Revere, Chelsea, and Winthrop, but not everybody knows what's out there, and it's not advertised. It's not in the local paper. You can't just open up a paper and say, oh, wait a minute, I can go there for, so that
Can you Google
one
it?
of us can, one of our agencies, we do know what's out there. We do know what the resources are out there. So if you come in to see us, and you come in with an issue that is not something our agency can help, we know where to send you. We know where to give you the resources, just as Stephanie and Sylvia have said. If, what they, have somebody that comes in to see them, that maybe be something that CAPIC could help with, and, vice, the same thing.
Things are changing all the time.
Yeah.
None of us has a
Yeah.
big advertising budget. The government
Right.
doesn't have a big advertising budget, and
Yeah.
so
But
we're
there are
all
resources.
we're all at the same meetings all the time. So that's
Right,
how
so
we.
we've always kept up on, we know what the resources are, we know what's new out there, and we know what's not existing anymore.
And
so.
how we want to distribute it to everyone. And thank you very much for all this input. And before we do some summary, you want to give some pair of wisdom, last tips for our audience?
I can start. I want to encourage all our community members to reach out to one of our agencies, and please make sure that you ask for the resources if you're looking for education, whether it's on computer classes, English classes, or a specific training that you're looking for. That we currently have a lot of hospitality training, not at the collaborative, but our partner organizations such as Connect. Please reach out to us. We will refer you. We want you to be prepared. We want you to take advantage of it. Come and build your resume, do your skills more. Just give us a call.
Right, and I would agree with Sylvia on that. I think it's important for people to understand that, we are here to help you, but you need to reach out to us. And there is nothing that, I know a lot of people come to us and say, well, I didn't know that I would qualify, or I would be able to, get this help before. Now you've lost your job, but I had a job, so I didn't think I was going to be able to qualify for your program. Everybody qualifies. That you need to come to see us in order for us to determine that, and to see what we can do to help you. Just reaching out is what's important.
I would agree with both Lee and Sylvia, and I would just add that again, I mean, a lot of us, there's a lot of us came from where you're at. We we do this work in part because we were raised on food stamps. We were raised on student loans. We had to struggle to figure out how to get into a good college and how to pay for it. So we've been there, and we pride ourselves at the Connect program. I know the Collaborative and CAPIC as well on treating people well, and just think of us as your assistants. We're there for you. We would like to help you figure out how to navigate these very difficult systems that can be pieced together to help you get where you want to go.
Thank you very much. And I want to end first of all, like we know from the studies that actually help is one of the main assets for our community to achieve self-sufficiency. And to be able to be healthy, you need a good job environment, which is a big part of our life. And we talk about what are the good quality jobs that are there, which should get some sense of autonomy, which should get some sense that we can move beyond the current level, and we should have a good sense of community building and being able to connect to all these resources in the community. And we want to emphasize that all these resources has been here for decades. No matter what industry is going to come, today is hospitality, tomorrow might be healthcare, all day might be IT, AI, or all these things. The main thing is that we know that our community has one of the biggest assets, which is you, the community member, that has had all these experiences, had training in either their country of origin or from here, knows things that other people don't know, that have struggled and have the experience in this struggle. They are just in the moment of needing the opportunity to get better. Again, it's like when the doctor, I love the analogy that Stephanie have, is that this is the moment that you can grow. It's the moment of pain, but it's also a moment of growth that you can achieve the most and build this community. You are going to be the person that is going to make Chelsea much better community, and these resources are to help to improve yourself, not only for today, but for all the future that we have for the community of Chelsea. Thank you again for coming to this show. We welcome any input that you have, and please watch the below slides to be able to get all the contact information of the great resources we have in the community of Chelsea, and also contact us if you have more ideas and also some suggestions for this program. Thanks again and have a good day. Okay, Silvia, la mayoría de nuestras audiencias, de hecho, hablan español y realmente enfrentan problemas bastante grandes y son los que realmente se beneficiarían por todos los programas que tenemos. Quiero empezar un poquito, quizás volver a discutir qué significa la inseguridad de empleo como un determinante social de salud. Dijimos ya anteriormente en los shows anteriores que determinantes sociales de salud son las condiciones en que vivimos, en que crecemos, en que aprendemos y en que nos envejecemos. Todo eso son oportunidades que tenemos en nuestra mano para mejorar nuestra salud. Y este show estamos concentrándonos en hablar sobre nuestras condiciones de empleo. ¿Podrías hablar un poquito sobre desempleo? ¿Qué significa? Inseguridad de empleo, ¿qué significa?
El desempleo es una estadística federal del país, de un número específico de personas que están accediendo a la búsqueda de trabajo. No está en realidad determinando la cantidad de personas que tienen trabajos que pagan poco dinero.
De calidad baja.
Poca calidad. En realidad nosotros estamos enfocados en las personas que no tienen empleo o que tienen empleo que es de baja calidad o de poca paga. Nosotros queremos que nuestra comunidad tenga seguridad en su empleo y seguridad de sostenibilidad financiera. Esto por un empleo que sea un buen trabajo, un buen trabajo que tenga beneficios, que tenga flexibilidad, que tenga seguridad, que ellos sepan de dónde viene el próximo pago y cómo van a poner dinero, comida en su mesa, y también pagar su renta y pagar sus facturas del diario vivir. Y las oportunidades
Sí,
para
como
avanzar
discutimos
también.
la calidad, nos enfocamos en que el empleado tiene autonomía, o sea, el poder, qué decir sobre planear su vida, la oportunidad de poder progresar y ir a un término mejor, y también la capacidad de tener comunidad, o sea, tener apoyo entre sus colegas y todo eso. Y hablamos que es importante esto de no tener inseguridad de empleo porque nos mata. Nos puede matar de corazón, nos puede matar de una gastritis, nos puede matar de un derrame, y sobre todo nuestra calidad de vida en cuanto a salud mental, de poder dormir bien, de no tener que estar dolorido el cuerpo entero siempre, y de poder, de hecho, planear un mejor futuro para nosotros mismos. ¿Nos puedes decir entonces cómo es que Chelsea o los recursos en Chelsea se puede utilizar para que nosotros podamos salir de esa inseguridad?
Bueno, yo trabajo en la colaborativa de Chelsea. En la colaborativa de Chelsea ofrecemos diferentes recursos como derecho del trabajador, derecho de vivienda, tenemos asistencia legal para vivienda, asistencia legal para el Departamento de Inmigración, y también tenemos el Departamento de Desarrollo Laboral, que es donde yo estoy trabajando fuerte, donde estamos educando a nuestra comunidad para que se preparen con las destrezas necesarias para poder obtener trabajos de buena calidad o de mejor pago, para que consigan un mejor trabajo considerando que viene el casino pronto ahora en junio, y ellos tienen alrededor de 5,000 posiciones que vienen. Y también los otros hoteles que están en nuestras áreas, que tienen muchas oportunidades, y también factorías, diferentes oportunidades en nuestra comunidad. No solamente en Chelsea, pero en los pueblos vecinos. También mi compañera aquí, Stephanie, trabaja en Connect. Ellos están en el edificio de T&D aquí en la Garrish Avenue, y ellos ofrecen también ayuda financiera, educación financiera, cómo mejorar su crédito, y también tienen entrenamiento y están trabajando en colaboración con agencias que están dando entrenamiento sobre servicios hospitalarios
como
para el hotel.
De la universidad.
Y también tienen un centro de carreras en la oficina donde ellos están también, que colaboran con ellos para las personas que están buscando trabajo o que necesitan un mejor trabajo también. Lo que hablé anteriormente sobre los datos federales, las personas que cuentan cada vez. Sí. Y entonces aquí mi amiga Lee, ella trabaja para la oficina de CAPIC, que tienen un sinnúmero de servicios y recursos para nuestra comunidad. Ellos ofrecen ayuda legal, ayuda con asistencia financiera para apartamentos, ayuda para calefacción en su casa, para cómo llenar su plan médico si se lo han denegado, y tiene muchos recursos también para cuidado de niños. Honestamente, nosotros somos 3 organizaciones aquí en la comunidad, porque somos una ciudad pequeña, pero somos ricos en recursos, y cada uno sabemos de los trabajos que estamos haciendo cada uno, y si llamas a cualquiera de nuestras agencias, te podemos referir si nosotros no ofrecemos el servicio. Otras ayudas que estamos aquí actualmente trabajando y colaborando es la coalición Chelsea 500, que es diferentes organizaciones de la ciudad que nos hemos juntado con la misión de que por lo menos 500 personas de Chelsea sean contratadas por el casino que viene ahora en junio. Pero eso es a corto término, a término corto. A término largo queremos que nuestra comunidad esté preparada para los trabajos que vienen y para que tengan mejor estabilidad de un empleo, en lo cual reduce el nivel de estrés, el nivel de cómo saber si vas a tener un plato de comida o no, y vas a estar más saludable.
Sí, o sea, obviamente conectarse a una de tus agencias, no importa cuál, a veces suena que es demasiado, y es difícil de navegar, pero conectarse con una de las oficinas puede entonces ser referida a otras agencias. Y lo queremos enfatizar, creo que Stephanie habló en inglés, de que esto no es caridad, no es un servicio para las personas que tienen menos capacidad. Más bien, sabemos los recursos que tenemos, la gente, la calidad de gente que tenemos en Chelsea, que están bien preparados, solamente necesita algo de asistencia para que ellos puedan florecer en sus vidas. Como CAPIC ha estado en la comunidad por 5 décadas, Chelsea Collaborative 3 décadas, y T&D ha estado
40 décadas.
40 décadas. O sea, están aquí para apoyarles. En momentos de crisis, como Stephanie refirió, es como cuando estás enfermo, un resfriadito puedes recuperarte fácil, pero cuando estás complicado un poquito, está el médico, la agencia de los hospitales para ayudarte a recuperar, para entonces ser una persona mucho más productiva para la comunidad, para ustedes y también para su familia y para sus amigos. La idea es poder levantar la autosuficiencia, poder que cada uno pueda abogar por sus propios derechos, porque lo merecen, son los derechos que tienen, y poder ser un mejor trabajador. Para eso le conviene a los empleadores también, porque podría tener eso. Dijimos que la salud sería mejor cuando usted tiene autonomía y puede planear su propia vida. Aparte de esos recursos que mencionó, nosotros vamos a tener al final del programa, chequeen por los diferentes números de contacto. No sé, Silvia, ¿tienes algún punto de sabiduría que puede darle algo más fácil, un tip que pueda darle a nuestra comunidad?
Solamente que la comunidad no tenga miedo de comunicarse con alguna de las agencias de nosotros, y que nos llamen, que busquen la información, que pidan los recursos. Si nosotros no lo tenemos en la colaborativa, pues quizás en Connect o en CAPIC o en cualquiera otra de las agencias que estamos aquí en la comunidad, que estamos dispuestos para apoyarlos y ofrecer los recursos disponibles. No tengan miedo y llámenos, por favor.
Sí, gracias, Silvia. Recuerden que el poder entrenar sus destrezas en este momento les ayuda también para poder florecer mejor en su vida. No es solamente para el empleo que viene este año, pero sino también para los empleos que vendrán a lo largo de su vida y también para usted darle buen ejemplo a la siguiente generación de
Claro.
cómo puede construir su comunidad.
Claro que sí. Gracias.